Hello and welcome to this week's episode of the Health Talk Show. My name is Betty Okere. I am your nutritionist. In the last episode, we talked about eating and diabetes. This week, we're going to talk about eating, but in children. We all imagine that breastfeeding is such an automatic skill. But I would like to tell you today that breastfeeding is actually a learned skill, both for the mother and the child who's going to cycle. Breastfeeding Day is celebrated between the 1st to the 7th of August. This is a date put by the UN to be able to celebrate breastfeeding. So why breastfeeding? There is no single food that can rival breast milk in terms of the nutrients, the energy, and the goodness which comes in antibacterial and antiviral properties to fight diseases in young children. Breast milk also has antibacterial and antiviral properties and antibodies which help the baby to fight diseases. And thirdly, breast milk also comes at a constant temperature that helps the mother not to worry about warming that food. The World Health Organization recommends that a child should be breastfed for 6 months exclusively. So what is exclusive breastfeeding? It simply means that the child or the infant will be fed on breast milk and nothing else, not even water. And if there has to be anything else that is introduced to the child's food, then it is medication that has been prescribed from a hospital. Why should we breastfeed exclusively for 6 months? In terms of the amount of energy the child is going to get from the breast milk, it is sufficient and one that the baby is able to digest in all its entirety. Also, when a child is born before they are 6 months old, their ability to fight diseases and their digestive system has not also formed in a way that if we gave them food from outside the mother's body, they would be able to digest it properly or be able to fight the diseases that would come along with that. Imagine that a mother is traveling from one point to another and they have to worry about what to feed their child when they're still going through that process of trying to learn their child. It can be really a task. So the mother just has to remove the breast and the baby suckles and everything goes. All mothers are advised to exclusively breastfeed their children up to 6 months in life. But breastfeeding continues with complementary feeding up to 2 years of a child's life. That is a very critical window period where the child gets all the nutrients they deserve and all the antibodies that will help them to fight diseases. What are some of the reasons that a mother would not be allowed to breastfeed? One of them is if the mother is HIV positive, if the child has a condition called galactosemia. In other words, they have a problem digesting the breast milk. If the mother is a hard drug addict, maybe they're using marijuana or they're using cocaine, or also if the mother is taking some medications, some prescription drugs, maybe for a condition like Parkinson's disease, in some cases arthritis, then the mother would be advised not to breastfeed. However, if it is a prescription drug, then the mother has to ask their doctor if they are okay to breastfeed with that kind of condition. So if the mother is HIV positive and they have a low viral load and maybe they're not on medications, they will not be allowed to breastfeed the child for fear that they can transfer the virus to the child. If the child has a condition called galactosemia, in other words, they have a problem digesting the breast milk, then we would advise that mother not to be able to breastfeed as is recommended. In other words, they have a problem digesting the breast milk. If the mother is going through chemotherapy, which is treatment for cancer, it is also advisable that the mother does not breastfeed so that they do not transfer the drugs that they're taking through the breast milk to the child. If the mother is treating tuberculosis and it has not been treated properly or they're still undergoing that treatment, they haven't completed the dose, then the mother would not be allowed to breastfeed. Why? Because they can transfer the tuberculosis virus to the child. In other instances, also the mother has to discuss if they are on iron supplementation or vitamin D supplementation then is it okay to continue breastfeeding the child, or the mother has to stop that supplementation for a while before they continue breastfeeding the child. So apart from the medical conditions that may make it impossible for a mother to breastfeed their child the way they would want or how it is advised, there are also some personal conditions that the mother may be going through that may make it difficult to breastfeed. What are some of these challenges that a breastfeeding mother might have? So we have cracked nipples. And normally this happens when the mother does not latch the baby properly. I will talk about latching later on in the show. Then it means that the baby will be suckling on the nipple like a straw, which strains the nipple and may lead to it cracking. Sometimes also the cracking may be caused by the kind of soap that the mother is using. Maybe it is too harsh, it is perfumed so much and it is leading to cracks, or they have lotion or jellies that they are applying on their nipples that may be also contributing to the cracks. And this makes it so painful that the mother is unable to breastfeed properly. In other instances also, the mother might have a problem of worrying so much whether they'll be able to produce enough milk. This worry is actually founded because most people will think that milk is stored in the mammary glands. This is not the case, because milk is a let-down reflex action from the brain to the nerves in the mammary gland. And if the child is ready to cycle and the mother is also ready to breastfeed, then that should be an automatic process. There is also the issue of stress. So if a mother is stressed about either the child or what is going on around their environment, they might not be able to produce enough milk. So there is need for support. We earlier on talked about latching. If a baby is latched properly on the breast, then they should be able to have their mouth covering the black part of the breast, which is called the areola, and not simply holding onto the nipple. So when the mother latches the baby to be able to breastfeed, the baby should be moved towards the mother and not the mother bending towards the child. That makes latching very easy and it helps the baby to breastfeed as much as is possible. How will the mother know that the child has latched properly? There will be no pain while breastfeeding, and you can hear some swallowing sounds from the child, meaning that they are able to drink in something. So what if you're going back to work after exclusively breastfeeding for 3 months? It is advised that the mothers express this milk. They can do it manually or by use of a breast pump and store it in their fridge and the freezer, so that the child has enough supply even when the mother is not around. In our next episode, we will respond to your feedback and your questions about how to exclusively breastfeed or how to express and store breast milk safely for your child. We appreciate your feedback and comments on our show. You can use our SMS number 21129. Thank you. That is all we had for this week's episode of the Health Talk Show. My name is Betty Okere.